I'm Dr. James Whittaker, and a 72-year-old patient once shared a concern that many men feel, but rarely voice. He said, "Doctor, I've been doing things the same way for 50 years, but lately something just feels wrong." He wasn't sick and hadn't started any new medications. What he didn't realize was that certain habits practiced over decades were now silently working against him. The hidden crisis, affecting men's intimate health after 60. What if the changes you're noticing, less sensation, weaker performance, or just a feeling of disconnection, aren't just about getting older? What if they're linked to common mistakes that are silently harming your circulation, your prostate, and even your ability to feel pleasure? It's not the act itself that's the problem. It's how it's being done. In today's video, we're going to uncover 7 of these silent mistakes that many men over 60 make, and more importantly, how to correct them to restore your vitality and health for the long run. After treating thousands of men in my practice, I've discovered that these seemingly innocent habits can cause profound damage to male sexual health, circulation, and overall well-being. The good news is that every single one of these mistakes is completely reversible with the right knowledge and approach. Mistake number 1, high-intensity pornography, the brain's reward system destroyer. For decades, this might have seemed harmless, but after 60, the brain's reward system, which is powered by a chemical called dopamine, isn't as resilient as it used to be. High-speed, high-intensity internet pornography floods the brain with far more stimulation than it was ever designed to handle. When this happens day after day, week after week, the brain adapts in the worst possible way. It becomes desensitized and starts to require that extreme level of stimulation just to feel anything at all. This means that the natural spark of intimacy, the touch of a partner, your own imagination, the simple feeling of connection, begins to fade completely. The neurological damage you can't see. It's like listening to music with the volume turned up to maximum for years. Eventually, you can't appreciate the subtleties of a quiet melody. Your brain's pleasure centers become so overstimulated that normal, healthy sexual experiences feel dull and unsatisfying. Recent neuroscience research shows that men over 60 who consume high-intensity pornography regularly show measurable changes in brain activity. The areas responsible for natural arousal and emotional connection literally shrink, while the areas associated with compulsive behavior become hyperactive. The recovery solution that actually works. The solution is to retrain your brain systematically. Begin to focus on your own physical sensations and imagination. If you're with a partner, focus exclusively on their touch and presence. The goal is to recalibrate your nervous system back to what is real and truly fulfilling. This process takes time, typically 4 to 6 weeks of conscious effort. But men who follow through report dramatically improved sensitivity, stronger emotional connections, and more satisfying intimate experiences than they've had in years. Mistake number 2, the bathroom habit, crushing your circulation. For privacy and convenience, the bathroom often becomes the default location for self-pleasure. But this habit, especially sitting on the toilet, can be incredibly damaging over time, particularly for men over 60 whose circulation is already compromised. Think about the posture you're in, hunched over, compressing the entire pelvic region. This position restricts critical blood flow to the nerves and tissues that are essential for sexual function. It puts direct, sustained pressure on your prostate and creates chronic tension in the pelvic floor muscles. The hidden circulation crisis. With aging, protecting your circulation becomes paramount. Healthy blood flow is the foundation of firm erections, prostate well-being, and even your ability to recover after climax. By consistently compressing this vital area, you're silently starving it of the oxygen and nutrients it needs to thrive. I've seen men in my practice who developed chronic pelvic pain, erectile dysfunction, and prostate problems directly linked to this seemingly innocent habit. The compressed position can also contribute to hemorrhoids, lower back pain, and urinary difficulties. Creating circulation-friendly environments. The solution is simple but crucial. Change the environment completely. Stand in the shower, lie down comfortably, or recline in a position that allows your pelvic area the space it needs to breathe and for blood to circulate freely. Your prostate is silently begging you to stop compressing it. When you give your pelvic region proper space, you'll notice improved sensation, better blood flow, and reduced risk of long-term complications. Subscribe to the channel right now. If you're finding this information valuable, I share life-changing men's health secrets every week that could transform your intimate health and overall vitality. Hit that subscribe button and notification bell so you never miss crucial information that your doctor probably isn't discussing with you. Mistake number 3, the rush to finish, turning pleasure into stress. In our busy lives, it's easy to treat self-pleasure as just another task to be completed quickly. But when you rush this intimate process, you're putting your nervous system into a state of stress, not pleasure. Your heart rate spikes unnaturally, your breathing becomes shallow and restricted, and your body releases harmful stress hormones. While you might still reach climax, you're completely missing out on the profound hormonal and cardiovascular benefits of a relaxed, mindful experience. The restorative hormones that reduce stress and promote well-being, including oxytocin, endorphins, and growth hormone, are barely released. The stress response versus the relaxation response. After 60, your body doesn't respond well to pressure, either literal or emotional. The goal isn't to race to a finish line like you're 20 years old. It's to enjoy the journey and reap the health benefits that come with proper relaxation and mindful pleasure. Research from Johns Hopkins shows that men who practice mindful self-pleasure experience lower blood pressure, reduce cortisol levels, and improve sleep quality compared to those who rush through the experience. The solution is practicing mindfulness consistently. Slow down intentionally, breathe deeply and consciously throughout the experience. Pay attention to the sensations in your body without judgment or hurry. Make each moment deliberate and purposeful. When you do this, you transform a mechanical act into a genuinely restorative experience that benefits your heart, mind, and entire nervous system. Many of my patients report feeling more energized and emotionally balanced after making this simple change. Mistake number 4, ignoring your pelvic floor, the hidden power center. The majority of men have never even heard of their pelvic floor, yet it's one of the most vital muscle groups in the male body, especially after 60. Imagine a supportive hammock of muscles at the base of your pelvis. This is your pelvic floor. It supports your bladder and prostate, and it's the hidden engine that powers everything from the force of your erections to your urinary control. When these muscles are weak or neglected, everything starts to deteriorate rapidly. The consequences of pelvic floor neglect. You might experience urine leakage, significantly weaker erections, less sensation during climax, or difficulty reaching orgasm at all. Through years of sitting and lack of specific engagement, these muscles can become almost completely dormant. The pelvic floor also plays a crucial role in prostate health. Weak pelvic floor muscles contribute to prostate enlargement, chronic pelvic pain, and increased risk of urinary tract infections. Reawakening your power center. The good news is you can reawaken these muscles at any age. The solution is to consciously and gently engage them during intimate moments. During arousal, softly contract the same muscles you would use to stop the flow of urine midstream. This isn't about forceful clenching. That can actually cause more harm. It's about gentle, mindful engagement that builds strength and awareness over time. Incorporating this practice develops both awareness and strength, restoring a foundation of control and power that many men thought was permanently lost to age. Mistake number 5, wrong frequency, too much or too little. This is a topic many men over 60 hesitate to discuss openly. Some fear they're engaging in self-pleasure too frequently, while others wonder silently if they've waited too long between sessions. The truth is, both extremes can cause significant harm to your health. When a man masturbates too frequently, often out of habit, boredom, or unresolved emotions, the body doesn't have adequate time to recover. The nervous system becomes overtaxed. prostate tissue can become chronically irritated, and overall energy levels drop dramatically. The use it or lose it principle. On the other extreme, when you go too long without any sexual excitement, you risk what's medically called use it or lose it atrophy. The body needs regular circulation to maintain healthy function. Sexual arousal, even without orgasm, helps maintain crucial blood flow to the genitals, nourishes nerve endings, and keeps tissues healthy and responsive. Studies show that men who have no sexual activity for extended periods experience measurable decreases in penis size, sensitivity, and erectile function. The tissues literally begin to atrophy from lack of blood flow and stimulation. Finding your personal balance point. The solution isn't a magic number that works for everyone, but finding your personal point of balance. For most men over 60, once or twice per week, done with presence and care, represents a healthy equilibrium. This allows you to maintain circulation and hormonal rhythm without causing exhaustion or depletion. Listen carefully to your body. It will tell you what feels energizing versus what feels depleting. After healthy self-pleasure, you should feel relaxed, satisfied, and energized, not tired, guilty, or empty. Leave a comment below. And tell me if you've experienced any of these issues or if you have questions about finding your optimal frequency. I read every comment and often provide personalized advice. Also, share what country you're watching from. I love connecting with men worldwide who are committed to improving their intimate health. Mistake number 6, excessive force, the sensation destroyer. This is one of the most overlooked and damaging errors that men make, especially as they age. As sensation naturally changes with age, the instinct is to compensate with more force, a tighter grip, more aggressive friction, increased pressure. The thinking is, if I press harder, I'll feel more. But the opposite is actually true. The nerves in the penis are incredibly delicate and become even more sensitive to damage as you age. Years of aggressive friction can cause real measurable physical damage to these delicate tissues. The silent accumulation of tissue damage. This damage includes microscopic tears in sensitive tissue, progressive loss of elasticity, and even internal scarring that can lead to curvature and pain during arousal. This type of trauma is a silent thief that doesn't happen overnight, but accumulates slowly over months and years. By the time you notice significant changes in sensation or function, the damage is often well underway and much more difficult to reverse. Some men develop a condition called Peyronie's disease, where scar tissue causes painful curvature and further loss of sensitivity. The gentleness solution. The solution is to be consistently kinder to your body. The truth your body is trying to communicate is this: force doesn't restore sensation, it destroys it systematically. Instead of increasing pressure, focus on varying the type of stimulation. Use high-quality lubrication regularly. Explore lighter, more varied touches. Focus on different areas and types of stimulation rather than just intensity. Experiment with temperature, rhythm, and technique rather than simply applying more force. Mistake number 7, emotional disconnection, the most invisible error. This final mistake goes beyond the physical and into the mind and heart itself. Over time, many men start to see self-pleasure as purely mechanical, a routine release devoid of any real meaning or emotional connection. It becomes a silent escape from loneliness or a habit performed without thought, emotion, or positive intention. When masturbation is disconnected from feeling and meaning, the nervous system is trained to expect pleasure without purpose or connection. You might reach climax, but the brain and body don't release the same restorative hormones that come from emotionally connected experiences. The hormonal consequences of emotional disconnection. You don't get the mood-lifting oxytocin or the motivating dopamine that comes from a truly connected, mindful experience. Instead of feeling satisfied and energized, you might feel empty, drained, or even slightly depressed afterward. This pattern reinforces the destructive idea that pleasure is something to be taken alone, in silence, without joy or positive emotion. Over time, this can contribute to depression, social withdrawal, and decreased motivation for real intimate connections. Reconnection and sacred self-care. The solution is conscious reconnection with your own body and emotions. Even solo intimate time can be sacred, mindful, and deeply affirming. It can become a moment to reconnect with your aging body, not with shame or disappointment, but with gratitude and acceptance. Practice appreciation for your body's capacity for pleasure, regardless of how it may have changed over the years. This shift in mindset can transform a mechanical habit into a healing, restorative practice that supports both physical and emotional well-being. Now that we've explored these 7 critical mistakes, let's understand what they all have in common. From using excessive pornography to choosing poor positions, rushing the process, ignoring key muscle groups, finding wrong frequency, using excessive force, or disconnecting emotionally, they all represent a loss of connection. This is the real threat to male sexual health after 60, not age itself and not decreased desire, but the slow erosion of connection with your own body, your own capacity for pleasure, and your own inherent vitality. The encouraging news is that it's never too late to make positive changes. Your body is still capable of remarkable recovery and improvement at any age. Think of it like maintaining a classic car. It may need a different kind of care and attention as it ages, but that doesn't make it less valuable or capable. In many ways, the experience and wisdom that comes with age makes intimate health even more meaningful. So where do you start? Begin small and be patient with yourself. Practice greater gentleness in all aspects. Become more conscious and mindful of your habits. Take time to relearn and rediscover your body's responses and needs. Remember that your best years are not behind you. They're in how you choose to live this next chapter with greater care, wisdom, and self-respect. Every positive change you make contributes to better circulation, improved prostate health, enhanced emotional well-being, and more satisfying, intimate experiences. I'm Dr. James Whittaker, and I believe that every man deserves to age with dignity, vitality, and satisfaction. These 7 mistakes are completely correctable with the right knowledge and consistent application. If this information has been helpful to you, please like this video and subscribe to my channel. Share it with another man who might need to hear this important message. Together, we can help men age with greater health, confidence, and joy. Thank you for having the courage to address these sensitive but crucial topics. Your willingness to learn and grow is the first step toward reclaiming your vitality and living your best life after 50.